a moment to log in that wants to attend. Okay. So hi everyone. Thanks for coming to our virtual open house today with Advanced Dermatology. We're doing things a little bit different, as you can see, and wanted to really do this for you guys and say thank you for all of the really sweet emails and calls and text messages that I'm continuing to receive during this time of uncertainty that we're all going through. And we were going to have our annual spring open house, and I thought, let's just do it this way so that we can still bank these savings and hang on to all of these things so that when we open our doors, you can have all of these treatments with an added bonus, savings, and all of those things. So that's why I wanted to do this today. I just wanted to say I hope everyone is doing well, taking care of themselves and those that are around them, treating everyone with love and kindness. A special thank you and gratitude to all of our medical and healthcare workers out there doing the unthinkable that most of us could not even imagine doing right now, and our hats are off to you. So thank you so much for your sacrifice, which is what it is, and getting out there on the front lines for us. I hope that everything will be back to normal as soon as possible so that I can see all of your faces. I miss seeing you so much and working with my hands on your beautiful faces. So I want to talk a little bit about the savings that we're offering today, and then of course I'll answer some questions. Hi Melissa. I'm just gonna kind of touch the screen here and there to kind of go up and make sure I'm seeing all of your questions as well. So I chose some of the treatments that we offer that seem to be our most popular, most requested treatment. We'll start with the laser hair removal because we don't generally do a lot of specials with laser hair removal, mainly because we keep the pricing of our laser hair removal treatments so competitive that we don't really have to do a lot of gimmicky promos and things like that. Just because they are priced so affordable for you guys, so that it's accessible to all of you. But we are doing our BOGO packages. Thank you, Melissa. We miss you. It's buy any package of laser hair removal, the 8 sessions that are in the package, and receive 4 sessions for free. So that's a great savings of free treatments. So let me explain what that means. So let's say you're interested in purchasing, we're just gonna choose something easy, the axilla or the underarms, okay? And when you purchase those 8 sessions up front, you can get 4 sessions of anything equal to $100 in value or less than. So what that means, hi Rebecca, is if you do your underarms, we could do your chin, your lip, and that would be complimentary or free. And that would just be banked into your treatment. So it's a great opportunity. If you're already on the fence about doing laser hair removal, you get another area for free. So definitely an opportunity worth grabbing while it's on special. I can tell you firsthand, out of all the things that I have done in the 16 years I've been in this business, not having to shave my underarms is the best thing that I've ever done in my entire life. So definitely do it. It's worth every penny. So, oh, hi guys. So yes, and just to go a little bit into the laser hair removal, one of the questions I got on the Instagram live was, can you have laser hair removal if you have dark skin? Absolutely. So it's a great question, but it's really important you as a consumer to ask your practitioner or your provider if they have the ability to treat dark skin tones first and foremost with the equipment that they have. In this practice, Dr. Patel has invested in capital equipment. She actually has 2 devices, and we have one specifically made by Candela. It's a YAG-based laser that can be used on all skin tones, specifically skin of color. That was the question. Can darker skin tones have laser hair removal? Absolutely. We would use and be able to give you the sessions completely safe. And for the most part, they're completely painless, in my opinion. We can do things to make you even more comfortable, but generally just icing the area. It's a really quick session. Making sure that the skin is clear of any hair. That's one of the number one questions. Any hair on the area that you're going to have treated needs to be completely shaven down. So no hair present on the surface of the skin. Otherwise, the laser, when fired, the heat would singe that hair. It would singe that hair and then burn the surface of the skin instead of going deeper within the skin, which is what we want. So make sure that you're clear of any hair or facial debris whatsoever. And secondly, and most important, make sure that you have no makeup on the skin. The lasers are attracted to melanin, so that's essentially what makeup is just pigment. So make sure that you don't have any makeup on when you come in for your session. If you do, no worries, I'm an esthetician, I can wash your face for you. So no problem with that. If you're coming straight from work, it's not an issue. So absolutely a great laser hair removal treatment. If you're already a patient or a customer that's getting laser hair removal, I see someone ask, I'm already having the sessions, can I purchase this package? Absolutely, you can at any time or start another area for sure, absolutely. So if you guys are losing my connection, I apologize. It's coming in and out here, so I'm so sorry. I'm gonna move on down. Someone's asking, do we do IPL? Absolutely, IPL. IPL is one of my favorite treatments for rosacea, for pigmentation, for overall redness in the skin, but mainly geared towards pigmentation, so sun damage. It's an acronym for intense pulse light therapy. It's a non-laser device that utilizes a flash lamp that is attracted to the melanin in the skin. When it's fired onto the skin, it seeks out that target. It essentially emits all that energy into that pigmented cell, burns it, and brings it towards the surface of the skin. So the skin is left intact. However, the pigmentation or the freckle or the sun damage or the lentigo in itself will become more superficial, coming to the surface of the skin, look a lot like a coffee grain texture, almost like you could kind of, flick it away, and then it'll shed off in about 5 to 7 days after the PL that you understand. It's a lot like, I like to use the analogy of an iceberg. What you actually see on the surface of the skin is really no indication of what's going on deeper within the skin. So it does take multiple sessions to get a clearance or a clinical endpoint. My favorite word in this business is treat to complete. That's my favorite saying, I should say, treat to complete. So you want to make sure that when you begin this procedure, you're committed to the process and that you see it all the way through so that we can completely clear out that cell from the skin. It is something that should be repeated annually, absolutely. We do acquire new sun damage every year, all throughout the year, even when you're practicing safe sun procedures like vitamin C serum and sunscreen and all of these things that we do, you're still going to get some sun damage. So it's something I tell most of my patients to go ahead and schedule annually in the fall. It can be treated in the summer, however, it is not the most ideal time. I personally treat all year round if needed. I would just advise my patients to avoid direct sun exposure if you've got vacations or something going on, or if your lifestyle is something where you're outdoors a lot or in direct sunlight. We may talk about timeline and kind of changing that around a little bit. But IPL can also be used for redness in the skin. It's a great treatment for rosacea. So it's one of my favorite treatments just for overall skin tone improvement. I use it on myself quite frequently, just to make sure that my skin tone stays even. When you're fair complected, you can definitely show a lot more sun damage. So definitely a great one. Let me see if how many treatments do you need and what is the downtime? Okay, so with IPL, I assume you're asking, Jenny, generally you're gonna do between 3 and 6. everyone's a little bit different based on, now I have allergies, I'm so sorry. These treatments are going to be spaced 3 weeks apart, and in regards to downtime, relatively left intact. So you can wear makeup and all of those things. You may see, because on the surface of your skin, the brown spots may be more evident, darken of course, and come to the surface. But it's not really downtime. I don't think it would interrupt your social calendar, your work calendar, or any special event that you would have. You just may have to pull out a little bit of concealer. So, absolutely. Hey, Karen. On and talk about some of the other specials. Of course, just about anything. I also have another phone here where people are tweeting questions in as well, so you may see me looking down and looking at them. I have someone on here that asked, how many treatments will you need for Ultherapy? Ultherapy is probably my favorite laser treatment that we have in the practice. I have been an advocate for this medical treatment and device for many years. It is my favorite treatment for lifting and tightening the skin all over. Specifically though, we're talking generally on the face. Ultherapy is a medical device that utilizes a wavelength called HIFU, high intensity focalized ultrasound. And with this wavelength, it essentially causes a controlled injury at different depths in the skin, starting at the baseline of 4.5 millimeters all the way to a more superficial depth in the skin at 1.5 millimeters, which is more epidermal. And what it does essentially is it lays thermal injury points into the skin, just tiny little baby injuries into the skin repetitively, and it causes an inflammatory response. That inflammatory response causes the collagen and elastin essentially just to kind of recoil or tighten. I like to use the analogy of like a rope. As we age, your skin looks like a rope, how it's kind of, the matrix of it is set up. And as we age, it just kind of starts to unwind a little bit, and then we start to lose structure in our jawline, we see laxity, we start to see jowls, we see this lovely waddle I'm genetically blessed with, thanks Dad. But we see these things happen as we age. And what Ultherapy does is it targets those, it tightens the skin and it lifts it. It also is the only FDA approved treatment on the market that has a clearance that actually says that it lifts the skin. It's actually kind of fun as a consumer. If you are ever interested in doing any type of skin tightening or body treatments or lifting treatments, there's many on the market, as we all know. You can go to the FDA.gov website and look and see what it has medical clearance for. And a lot of times you would be surprised that what you're purchasing is really not even indicated for what it has clearance for. So what's unique about Ultherapy is it actually has that clearance. It's specifically geared for lifting and tightening the skin. It's generally going to be a one and done session. Now, that's based on someone who comes in and presents with a skin on a spectrum that would be in a mild or moderate category in regards to their degree of laxity. If you're someone who has a more severe case of laxity or has the skin that's hanging, or someone who would probably be better suited for surgical intervention, it's not that I can't help you or that Ultherapy is not the right choice for you. If it aligns with what your goals are, then absolutely there's value in stimulating collagen. But if you have a pretty severe indication of laxity, you're going to probably be someone who does more than one session. However, in general, to answer your question the long way, it's a one and done session for sure. When I have my patients come in and have the procedure, you guys come back at the 4-month mark. I take your photographs, we look and we assess them, we do our side-by-sides, I feel and I touch the skin to see it, the thickness and the density of the tissue change. At that point, we would discuss targeted treatment on a specific area. For instance, here's one of the transducers. Let's say the patient comes back at 4 months, they're extremely thrilled with how their jawline has contoured, the placement of their cheeks are lifted, all of that looks great. But if you're someone like me who has maybe more laxity like here, you could always do a targeted treatment just on that area, or if you're jowly, we can do right here to kind of help boost you along even further to matching where your goals are. So it's always my goal to match your expectations. I just have to map it out for you in regards to how we can get there. It may not be a straight and narrow path. We may have to kind of take it a different way to get and match up with your goals, but that's definitely always what we're trying to acquire when you're having these procedures. So the special that we're offering, when you purchase Ultherapy, you get a free laser peel. And what that means is we have an erbium laser, which we use for resurfacing, and we have a more mild setting that we can choose. And it's basically going to do what a chemical peel would do all over your face, that effect. And so it's really going to be great for texture, fine lines, large pores. It's amazing for that. Any type of superficial kind of scarring, it's also going to be a really great treatment for that. Smoothing the skin is probably what it's renowned for. It's one of my favorite things to do for skin smoothing besides microneedling. I would say it's a great treatment for that. So it's a $1,000 session that would be included with the Ultherapy, that you would have as something that you can purchase with it. And it partners beautifully with it because part of Ultherapy is also working on the superficial levels of the epidermis. So it's a wonderful treatment to kind of give you that 360 look that we all want, where we want that tight, taut skin and poreless glass skin that we're all trying to achieve. So absolutely. Hi, Brian. Yes, Ultherapy does rock. It's my favorite. So if you have any questions about that, or you're interested in Ultherapy, or you're on the fence about it, or if you're one of my beautiful patients who is probably due for your annual treatment coming up, jump on this special. It's a great opportunity to have that treatment for free. It's a newer laser to our practice. Dr. Patel is really, really about investing in our capital equipment here and making sure we're on the cutting edge of having the best technology that I can offer you guys. So it's a great way to introduce you to this laser peel, and so it's a great savings. Definitely jump on it. I'm looking at this tweet right here. Is there downtime with that treatment? So because of the fact that it's a laser peel, I would say assume that you're going to have the same amount of social downtime as you would with a medium depth chemical peel. So for probably a good week. Not to say that you can't do your normal activities or wear a tinted sunscreen or oxygenated makeup, but you're probably not going to look your best for that 1 week, for sure. And yeah, they can be done same day. Definitely do that because they are working on different depths in the skin. So there's really no contraindication to doing them both same day. If you're up for it, we can definitely do that. Or you can come back when it suits your schedule. It will be a credit in your account and we can do it then. So absolutely. Vive. So the Vive special, you're going to save 15% on that treatment. So if you're someone who is interested in Vive or has had Vive and you want to do another session, it's a great opportunity to jump on it for that. If you're unaware of what Vive is, I'm just going to give you a brief summary of Vive. What I would suggest is if you're interested in a consultation for this treatment, go ahead and set up a virtual consultation with us downstairs through our telemedicine portal, and I'd be happy to answer all your questions about Vive. But essentially what Vive is it's a vaginal rejuvenation treatment. Essentially, the treatment utilizes a non-surgical radiofrequency device. There's a small probe that is inserted into the vagina, and we emit a energy of monopolar radiofrequency. So essentially, it's a heat-based thermal injury that occurs into the tissue and causes a rejuvenating, regenerative effect to occur, so stimulating that tissue. It is a 30-minute treatment. It is really comfortable. I can say that as a consumer. I have had the treatment. I think I was more anxious than anything, anticipating that it was going to be painful or uncomfortable. It really, really wasn't. I've had other vaginal treatments on the market. We won't say what they are because I don't want to be ugly, but those were not the most comfortable, and there was some lifestyle disruption. We'll call it that. I'm sure you can use your imagination, ladies. So there was a little bit of disruption with that. This one, absolutely not. It is for the production of new collagen. So it's going to thicken that vaginal wall for you. It also has the ability to treat the pelvic floor muscles. So you're going to have a controlled urination. You're going to have less bladder leakage. Urinary incontinence is another treatment that we can utilize it for. It has FDA clearance for that. So I would say it is a beautiful treatment option for the improvement of just your female health and lifestyle. So a great opportunity to catch it while it's on special. It is performed here in our Germantown office. You can do it on your lunch break and go back to resume your normal activities. I would say after I personally had the procedure, I would say about 45 days into post-treatment, I really noticed the changes, and I can't really tout its praises enough. It's such a great treatment. Really proud that we offer it in this practice, and it's something that I think every woman should definitely at least have a consultation on. If you have any of these symptoms or concerns or discomfort, it's definitely something that is worth your time, an investment in yourself that will only improve your lifestyle. So definitely check that out. We're going to be doing that. Moving on to her Bank Your Botox special. So she's doing, 50 units for $500, which brings that down to $10 a unit. And then she also has 100 units that you can bank for $950. So when she says Bank Your Botox, she doesn't mean just specific to that brand. Of course, we carry Botox, but you could also do Xeomin, which is a great alternative to Botox, neuromodulator. Another one in the family, which is newer, is Jeuveau, which is my personal favorite at the moment. And you can utilize these unit cards to lock in these savings so that when you come back in for your treatment, you've got it prepaid. A lot of people are asking me, how many units does it take for the brows? Everyone's a little different, and I don't always like people to judge by the number. Everyone's like, oh, that's so many units. It's really not. The number is more about area. If you're someone who just treats like your crow's feet or does a little bit in between the brow, I would say 50 units would be adequate for you. If you're interested in treating more of a broad area of the face, like myself, treating the forehead, crow's feet, and other areas, sprinkling your treatment all over the face, the 100 units is definitely probably something that would be better suited for you. And given that you might even have some left over for your next treatment in 4 months. So definitely a great opportunity. Choosing which card to go for, like I said, if you're someone who just does one area, 50 units should be adequate. You may even have some left over for your next treatment. However, generally speaking, unit dosing for a forehead, the package insert says 45 units is standard, and most people do a little bit more than what, the package states to use. So don't think that 100 units is so much. Some people are just a little put off by that number. It doesn't mean that you have to use all 100 units, but it's a great opportunity to lock it in at a discount. It's normally $13 a unit in our practice. As far as our injectors go, we have, of course, Dr. Patel, who's our expert. We have Dr. Gordon, and we have Misty, who's our nurse practitioner who has a lot of experience with cosmetic injectables as well. So any of them can treat you and perform your treatment utilizing your Bank Your Botox special as well. So whoever your provider is that you prefer, they all will be able to help you with that. All of our skincare today is 20% off. So if you are looking to add to your Zeo Skin Health line, re-up on any products that you're low on. If you need sunscreen, all of the Visha skincare products are included in this special. We are offering curbside pickup for these products. We will take your payment over the phone. You can call downstairs. We can grab you what you need. We will bring it out to you, not white glove service, but latex glove service with our masks on. Bring it to you. Make sure you still sanitize your products when you get them in your house. But we will have them and bring them right out to you. You don't even have to get out of your car. So absolutely take advantage of that if you'd like. Let's see. Any other questions? Let me scroll this up. I'm gonna look on here as well. What is your favorite sunscreen? So my favorite sunscreen is going to be, well, the brand of sunscreen that I've endorsed in our practice and personally is Ultherapy. And the two from that line that I absolutely love, if I was on a deserted island and I could only bring two things, I would bring sunscreen and mascara. That's what I would bring, and it would be from the Ulta products. The Ulta MD UV Clear 46 is probably what I wear almost every single day, and that's a chemical and a physical sunscreen, so that means that it has a chemical ingredient and a mineral-based ingredient of zinc oxide. All of their products are zinc-based, so you're going to get a physical sunscreen in there as well as a chemical sunscreen. The reason why I love the Ulta product is because it's probably the most cosmetically elegant that we have on the market. It goes into the skin clear like the name. It also has the addition. It's safe for all of those conditions. It has a very anti-inflammatory benefit to it. It's completely balancing to the skin. You don't have to add an additional moisturizer if you don't want to. It should partner well with other products underneath it, but I love it for everyday wear. It will not break you out at all. It's safe for anyone who has sensitive skin, so I love that one. And skin of color. If you have a darker skin tone, it should go right into the skin. I use it on my daughter who's got a darker skin tone, and it leaves no gray cast in her skin. So you should definitely wear sunscreen no matter what your skin type is, no matter what your skin tone is. Everyone should wear sunscreen. And no, the sunscreen that's in your makeup is not enough, but we'll save that for another conversation. You should always have a separate step in regards to your sunscreen and not what's in your makeup. So, oh, and also from them, my other favorite is the Ulta MD UV Elements 44. That is a tinted sunscreen. It is purely physical, so it's zinc oxide and titanium dioxide. We love to recommend that for post-procedure treatments. So after you've had a laser or a chemical peel or a microneedling session, that's usually what I hand you on your way out the door. Use this. This is what you should use for your post-care. This is your makeup. A lot of times I'll wear that on days that I don't want to wear makeup. During this time where we've kind of been furloughed at home, for most days, I will just wear that. Make sure that you're wearing your sunscreen even when you're inside, light does. I'm sitting in front of a window, so this is a good example of why you should wear sunscreen even while you're indoors. Also, we're getting that blue light from our phones that we all see when we are sitting like this all day or at work, so it's important to wear sunscreen for that reason as well. Yes. And like I said, all of these treatments will be in our website. You can call downstairs right now. Our number is 901-759-2322 and speak with one of our front office staff members who will be happy to take your call and get you set up with any of these treatments that you're interested in. And if you have any other questions, please do not hesitate to send an email. I'm happy to set up consultations with you guys during this time if you have more in-depth questions or you have something personal you want to discuss for any of the other sessions. So definitely take advantage of our telemedicine, our spa consultations. Just like this, I can look at your skin to the best of my ability. I can try and diagnose or answer questions based on what I see from the screen, and we can go from there. But yes, so to tune in. I want to thank you for all the kindness that you have extended to me, and especially to Dr. Patel and supporting her practice as a small business owner. We genuinely do appreciate every make to support us. I would encourage you, as we're sitting home and feeling that urge to spend or buy, to try and stay away from, and I'm not at all, we all know that I'm a girl who loves makeup and Sephora, but try to support small businesses during this time. Even if it's not from us, or if we carry something that you like that we don't have, I would so encourage you to purchase your skincare from people like us, professionals, small business owners like Dr. Patel. We are here to give back to our community, so we so appreciate every single way that you've supported us, sharing our statuses, liking, commenting, buying gift cards. You guys have bought so many gift cards to come and see me. I'm so excited for when I get back and get to see you guys. And I know a lot of you aren't huggers, neither am I, but all of you are getting a hug. I don't care. Hugging you all. So even if you just need a sunscreen, call us. We're happy to take that over the phone and meet you at the curb with a smile and wish you well. I just continue to pray for all of you. I know that this time has changed my outlook on, so I feel overwhelmed with gratitude more every day for every single opportunity, for everyone who's been supportive of me, for my job, for my employer, for my coworkers, for my beautiful clients. Thank you all for just supporting and being there and showing kindness and love during this time. I see one more question come up. How much sunscreen should I wear if I'm only inside? So generally, I will just kind of give you an opportunity to see. Generally, the pump on the Ulta products, the amount that you would need, but I would say for your face, a good quarter size amount should be enough, okay? And then you would apply that all over the face. And what I generally do is I would apply my sunscreen all over my face. The last thing that, if it's a physical sunscreen, which most of the zinc-based products are from Ulta, you can apply it last. Generally, there's a little bit of question on, should you apply a chemical sunscreen first and then a moisturizer? But in general, I would say apply it as you would the last thing, like you would armor before makeup, or if you don't wear makeup, it should be the last thing you apply. But I'd say a quarter amount should be adequate. And what I like to do is I will take an additional pump and I'll hit it just at the high points of my face or on the left side of my face, because that is the driving side. But that's completely up to you. A general amount, though, should be at least a quarter size amount for the entire face and neck. Make sure that you're applying your sunscreen to your neck as well and chest. So absolutely. Thanks for your question, Karen. So if no one has any other further questions, I'm going to go ahead and jump off here. Thank you guys for attending. If you have any other questions, or if you'd like to purchase any of the specials that I mentioned in detail earlier, just give us a call and we'll be happy to set that up. And I can't wait to see you guys soon. I miss you, and take care of each other and your